Today at Team Brief, I talked about the inpatient survey results for 2015, and Valerie shared with us the joint delivery program, which is a new way of delivering our key savings in partnership with our CCG. And Lorraine Knight talked about the emergency care performance improvement plan, which is going really well and has set us on course for improvement and success in the autumn of this year. Today I've been talking about the inpatient survey results with regards to the patients who were spoken to or received surveys about their care in our hospital last summer. What it showed us is that the drastic improvement that we made from 2014 to 2015 was largely maintained, and we are showing that we are about the same as most of the trusts in the country in terms of the experience we were able to give our inpatients.
So today at Team Brief, I've been talking about some of the joint work we're doing with our clinical commissioning group. As many of you will know, we do find ourselves in an economic climate that's tougher now than it's been for some time for the NHS, but there are ways in which we can address that work for us and, more importantly, work for our patients. So I'm sure all of us know examples of where we don't provide interventions for patients that are particularly helpful. So sometimes we do maybe too many follow-up outpatient appointments. And so there are real opportunities with our clinical commissioning group colleagues to think about where are those interventions where maybe we could do them differently, do them better, make the journey better for patients, but also reduce the overall cost to the health system.
Our urgent care pathway has been under severe pressure for a number of months, and this is causing anxiety not only in the organisation but also for our regulators. We were required as an organisation to agree a new improvement plan so that we could deliver the 95% constitutional standard by October. We've done a piece of work through engaging clinical teams to come up with 4 priority areas which we are currently working on. The first being the setup of an urgent care centre, which is now done and is running successfully. The second is the opening of an ambulatory care unit so that GPs have direct access and patients don't hit the emergency department. Thirdly, we need to change the way that our clinician workforce is rostered, move to a continuity model of 5 and 7 day care. And lastly, we have come up with a set of core clinical standards that we are hoping that teams will sign up to working with to improve the care of patients that come through the emergency department. So we have committed to delivering this target sustainably from October. And that's going to be a very difficult time of year, just as we go into winter, to do this. In order to make sustainable change, we need to do work on the culture in the organisation. And we started some of this with our urgent care centres showing us what good looks like. We've got increased clinical engagement, but we need more. We need to make some changes to our environment so that we are sure that our facilities are big enough for the volume of patients that come through our emergency care pathway. And in addition, we need to work very closely with our partners, such as adult social care, our community service providers, so that we can guarantee the flow of patients from the trust to a more appropriate care facility for their needs. And so finally, we're aware that we have a major piece of work ahead if we're going to make sustainable change. And we need the whole organisation's engagement in helping us to improve the care of patients on our emergency pathways. There will be more updates at future team briefs and on Aspire so that the whole organisation can keep up to date with the progress that we're making. The discussion today was about how we can engage the whole trust in helping us to deliver the urgent care pathway improvements, and what can they do as a team when they leave the room to ensure that everyone is contributing in their particular departments. We got some excellent feedback and ideas from differing teams. For example, the HR team thought there was more support that they could give divisions in terms of filling doctor vacancies, which are really important if we're to deliver quality care. The surgical team felt that they could carve out some time for their surgeons to concentrate on urgent care issues. We felt that we could come up with dashboards that would show staff across the trust the position each day. We could do more to communicate with the wards on the board rounds first thing in the morning in terms of the performance position, the numbers of discharges, and the situation in the emergency department every morning. So what we will do is, in a few months, we will be asking for further feedback from the teams that contributed today to find out what changes they've actually gone away and made following this discussion today.